For many women, midlife becomes a period of uncertainty as perimenopause symptoms emerge, often accompanied by limited information and unclear pathways to appropriate care, despite affecting half the population. Now, the provincial government and the Government of Canada have signed an agreement for the implementation of National Pharmacare in BC, which will cover the costs of more menopause hormone replacement medications for women and people going through this midlife experience. This coverage began yesterday on March 1st. So we're asking you, how will this hormone replacement therapy coverage affect you? What questions do you have about navigating perimenopause healthcare here in BC? Call us now. Just hit pound 690 on your cell phone, or you can call 1-800-825-5950, 604-669-3733. You can also email bctoday@cbc.ca or leave a comment on our TikTok live. Joining us now in studio are two professionals who work in BC's healthcare. Dr. Stephanie Fisher is the interim senior medical director of gynecology and specialized programs at BC Women's Hospital and Health Centre. Good afternoon to you, Dr. Fisher.
Good afternoon.
And Callie Wesson is the president and CEO of the BC Women's Health Foundation. Good afternoon to you, Callie.
Thanks for having us.
Thank you both for coming in with us. Dr. Fisher, I'll start with you. Tell us more about this new funding for women experiencing perimenopause here in BC.
Yeah, essentially, there has been pharmacare funding for a limited number of menopausal hormone therapies previously, but the amount of the funding was income-based. So now the funding will be across the board on all of the previously covered medications, but there will be no cost to women seeking that kind of care.
And before I suppose we go any further, I do want to just clarify some terms that we often see thrown around interchangeably. Perimenopause and menopause, or menopause, there's even post-menopause. Can you easily sort of break down these three phases?
Yeah, for sure. I think the tricky part is that menopause is defined as really once you've had 12 consecutive months with no menstrual cycle.
Right.
But of course, for most women, they only know that timing in retrospect. And we consider perimenopause all of the many years leading up to that. And for the average menopausal woman, they experience about 5 to 7 years of symptoms prior to the last menstrual period. So quite a long time that they can be very symptomatic prior to the actual date of menopause.
And Kelly, I'll bring you in too. As an advocate for women's health care in BC, how do you see this new hormone replacement therapy covering or impacting women?
Yeah, I think it does two things. One, it definitely says women's health is important. And I think that is a key piece as we talk about women's health. And then number two, anytime something's available to everyone, I think it's important. Yeah.
It is very important, and it is something that has sort of long been pushed aside, so it is nice to see it coming to the forefront and being important. I would love to have people call in and share their ideas and their journeys with us. You can call us at 1-800-825-5950, 604-669-3733. Let us know if you have any questions about this new medical coverage, if you have any questions about perimenopause and menopause, and also if you're going through this time, if you're comfortable sharing your journey with us, we would love to know. Dr. Fisher, before yesterday, BC Pharmacare did cover some hormone therapies already. So where are we seeing this new coverage differing?
The new coverage is really in the amount of the coverage. As I said previously, it was income-based, so women would often have to pay for a portion of their coverage, or they would be quite restricted in which medications were actually covered. The current medications are a little bit more broad, so we have lots of options of oral, transdermal, and vaginal preparations that are more available to women. So it's really important because it eliminates cost as a barrier to treatment for women across the province.
And I know that there's already, wait lists, to access midlife health care for a lot of women. So, now that it will become more accessible for women, is the province equipped to sort of take on that influx of patients who now want to access this free hormone replacement therapy?
Yeah, I think the truth is that the vast majority of menopause care for an average healthy woman experiencing menopausal symptoms can be delivered in the community with their family doctors or nurse practitioners. There's also a number of other providers, naturopathic doctors, et cetera, that are certified as menopause practitioners through the Menopause Society. So there's lots of care available. I think there's a bit of a misconception that all of this care needs to be provided by specialists, and that's really not the truth. It really can be done by primary care doctors.
Callie, what do you hear from women, across BC when it comes to finding a perimenopause, practitioner, especially I would think in remote communities where it can be even more difficult?
Yeah, one of the really great things about our Women's Health Research Institute at BC Women's, working with BC Women's Hospital and Health Centers, we actually have a webinar that gets the right information out to women. And I think that's something that's really key because I know we all follow social media and we're like, what's true, what's not? Really ensuring our Women's Health Research Institute is really set up to ensure the right information gets out to women across BC. And that's really important.
Where do you think we are still seeing the gaps, though, when it comes to care for perimenopause and menopausal women within BC and within Canada? We often say it affects half the population, and yet it doesn't seem to have that greater importance to some of the other issues.
Yeah, I can speak to that. So women make up 51% of the population and gave birth to the other 49% of the population. But really, like when you look at national health research funding, only 7% of funding goes into women's health. And really, that's what our foundation is trying to change through philanthropy. And one of the great examples of how philanthropy has really stepped up to work with the hospital, with government, is the Complex Menopause Clinic at BC Women's Hospital and Health Centre. So we are seeing, there's still inequities in women's health. We are seeing positive movement forward, and that's something that we can celebrate. This month is Women's Health Research Month, so we're really shining a spotlight. We won't have changes in care without great research. And I think Dr. Fisher can talk about research happening at the WHRI that's going to look at MHT and getting Canadian data and all of those things at the Women's Health Research Institute.
Absolutely. A lot of this policy discussion that we're having was informed by the HER-BC study that was produced by the Women's Health Research Institute. And they really looked to survey 2,000 women across British Columbia to identify, what are the health impacts for them and what are the economic impacts. And that same group is then looking at the effects of this policy on health outcomes and economic outcomes for the province as well. So we look forward to continuing our partnership with the WHRI to get more information on what the impact of this policy is.
Sounds great. We do have a call that's come in from Janet in Nanaimo. Hi, Janet.
Hi there.
Hi. And what are your thoughts on today's topic?
Oh, I think it's wonderful. I have a question. I started HRT probably over 10 years ago. At the time, I was diagnosed with osteoporosis, and I was also menopausal. And so I'm still on HRT, and I'm just wondering if I would be covered for that.
Dr. Fisher?
You would actually. The indication of hormone therapy for osteoporosis prevention and treatment is one that is included by Health Canada. So particularly for women who are symptomatic with menopausal symptoms, HRT is an often commonly used medication, but there are other options as well. If you're no longer symptomatic with menopausal symptoms, you could switch to a different type of osteoporosis medication that would be equivalent to hormone therapy.
Okay. And in terms of what is being covered, are there, treatments that aren't going to be covered by this new program?
There are a few. There are a couple of newer medications that are not yet covered in pharmacare, and those include things like fezolinetant and medications that work more centrally for the management of hot flashes, and some other more recent hormone therapy combinations. But truly, the ones that are covered are really the bread and butter that would be applicable to the average
Most
woman.
commonly, okay.
Yeah.
Got some emails that have come in. An anonymous viewer says, I began perimenopause at 42. I am now 65. I was unable to afford medication. Is it useful at my age now to start HRT? Also, why did I gain 60 pounds overnight? Diet and exercise have not changed, but I inherited somebody else's body. And that's a bit tongue-in-cheek, but that is, something that a lot of women do talk about, that suddenly their bodies seem very foreign to them. It can be a difficult transition of sort of figuring out who you are now. Callie, where do we need to support women as they're going through this journey?
And I would really go back to that menopause webinar, because we do have a webinar on that's getting that best information out to women. I think accessing the best information is really important. And, I also think just even this show talking about that feeling of I'm not just in my body right now. Things have changed. Like, we're all going through that. It's not every woman will have a baby, but every woman will go through menopause. And I think just the fact that with this announcements is really elevating the conversation around menopause is really important.
And it's still uncomfortable for some people. It still feels like a bit of a taboo, but I feel like the more we talk about it, the more we normalize it. It can impact a woman, but it impacts her career, her family. It can be quite far-reaching.
Yeah, it's quite dramatic, actually. The HERBC study did address a lot of that.
Yeah.
And it's quite shocking, actually. They reported that a third of women will report that menopausal symptoms impact their work. 1 in 4 women will say that they've reduced their hours or had to take time off work because of menopausal symptoms that are unmanaged. And 1 in 10 women leave the workforce because of unmanaged menopausal symptoms. So the economic impact of menopause symptoms is quite significant.
Yeah, very much so. I do want to address from our email, she was saying she was 65 and wondering if it was useful at her age to start HRT.
Yeah, generally speaking, hormone therapy is considered to be safe when started within 10 years of menopause. And unfortunately, her menopause was earlier than the average. So she would have to speak with her doctor about, what specific other health issues that she has that might preclude her from using hormone therapy at this stage. But there may be other non-hormonal alternatives that would be safe for her at that age.
Okay. We've got another call that's come in. This one from Mary Jane on the Sunshine Coast. Hi, Mary Jane.
Hi. I hope you guys are well today.
Very well. Thank you.
Good. So I have a question. I've been on VagiFem for, a couple of years now. And yesterday I went and refilled it. The pharmacist said it was on the list, but he couldn't figure out how to process it. So, I had to spend $300, and I'm just kind of wondering what's up with that.
Oh, that is unfortunate. I'm very sorry that you had to pay that out of pocket, but hopefully they'll be able to rectify that.
I would assume they should be able to reimburse for that. Our understanding is that it is being managed at the level of the pharmacies.
Okay.
But in fairness, yesterday was the first day, so there may be a bit of time to work out the kinks. But yeah.
I would head back there, and hopefully they'll have it all sorted out by now, Mary Jane. Thanks for the call. We've got an email in from Joanne in Victoria. She writes, I think the bigger problem is most doctors don't discuss this with their patients. My family doctor, who I won't leave because I know I won't get a new doctor, and the doctors are so pressured for time with patient care, it's not even a possibility for patients. This is a 40-year-old problem. Now that we have a healthcare system on life support, it's fine and dandy to have health plan changes, but you still need an assessment and prescription. And I suppose that is another part of the conversation is it is difficult for some people to just access healthcare to get a doctor that will be able to prescribe this for them. Absolutely.
And that is a difficult problem for many women and for many women who don't have a GP or a nurse practitioner in the province. What we recommend to our patients generally is that they download an app called the MQ6. It's a menopause questionnaire that is literally 6 questions that addresses menopause symptoms. And if you bring that to your doctor, it's a really nice starting point to have that conversation. And also for family doctors or nurse practitioners who are not as familiar, it also has a physician algorithm to help you guide starting menopause care.
Okay.
So it's a great resource for patients to access to start that conversation with their doctors.
Wonderful. We'll get a call in now from Zoe in Edgewood. Hi, Zoe. Thanks for joining the show.
Hey, thanks so much for taking my call. I among other female friends too, and it's a conversation that we've had that we don't have an answer to. Just a few of us in perimenopause experiencing more frequent cycles, more heavy cycles, debilitating heavy cycles, are lasting 2 weeks plus. I and some friends of mine have met with specialists to discuss, and The message that we're getting is that HRT won't help these symptoms. So I'm just wondering, from your expertise, because more info is better than not, what your thoughts are around this.
You raise an excellent point, and I would probably agree. In most cases, hormone therapy, menopausal hormone therapy, because the dose is very low, is not enough to override a natural menstrual cycle that's gone awry. And so, but there are many good treatment options, and that can be easily started with a family doctor, and might be things like low-dose oral contraceptives, which are very safe to take right up to the transition to menopause. We often use progestin IUDs to manage some of those menstrual symptoms. And the MHT is really more geared at managing things like hot flashes, sleep disturbances, and those kinds of symptoms.
All right. Thank you. Zoe, I hope that helps you. Not exactly fun, this stage of life that so many of us are in. Callie, we were talking earlier about new research and how we're finding out a lot more, and a lot more of a focus is going into finding out more. How does that translate, sort of, the research get translated into public awareness and clinical practice as well?
Yeah. So March is actually Women's Health Research Month, and Minister Josie Osborne proclaimed it at that.
Yes.
We are very fortunate in BC because we have one of the strongest, largest women's health research institutes in Canada, and in fact, it's world leading. And any change in policy, in care, it all starts with research. So when we look at that, only 7% of national funding going into women's health research, we have to change that. And really the quickest way to change that is through philanthropy. And yeah, it's nice to see this conversation and other conversations, because without us funding women's health research, care is not going to change.
Another call that's come in from Suzanne in Vancouver. Hi, Suzanne.
Hi.
Hi, do you have a question?
Yeah, I do have a question. I have been menopausal for about 3 years now. So not peri, postmenopausal, I guess.
Okay.
And I have I've been taking an SSRI, which has been managing hot flashes really well, and likely mood swings as well. But I have found since menopause that I'm having a lot of lower spine and hip issues. And I've been going through my doctor, who referred me to the VGH spine clinic, and I've been to a sports medicine clinic, and they're all kind of like, well, you've got good range of motion and strength, so keep doing what you're doing. And I'm like, I can't keep doing what I'm doing because I'm in pain all the time.
Right.
So I'm wondering if it makes sense to go to a clinic specifically for menopause therapy. I know those spaces are limited, and so I don't, necessarily want to waste space that somebody else needs, but I'm not getting any relief or any real, treatment at all, I guess. So, yeah, love to have thoughts.
Sure. I would say the difficulty with managing menopause symptoms is that there's so many different symptoms that can be associated with menopause, and so many other symptoms that happen at midlife that are independent of estrogen. We know that estrogen helps many things like hot flashes and sleep disturbance, but doesn't really have an impact on things like joint pain, low back pain, cognitive things. There's a whole bunch of other things that estrogen really doesn't play a role. So I would say probably I would carry on the path of looking at other management options other than MHT, because we wouldn't really expect it to benefit low back pain.
Okay. I hope that helps and that you actually are able to get a little bit of relief. We've got an email from Jillian. She writes, my question is whether or not testosterone gel will be covered in BC. This never seems to get included in general menopause, perimenopause care. I'm a primary care provider myself, and I'm lucky to know how to read the research and know how important testosterone can be for some people. My OBGYN did not mention it, but my family physician was willing to explore it with me. So is this covered under the new plan?
Testosterone therapy is not covered under the new plan, and part of that is the limitation of there is no product available in Canada that's approved for women. So currently when we prescribe testosterone as part of MHT, it's actually a compounded preparation based on pharmaceutical that's approved for men. So we're using it as an off-label product. So unfortunately, there's no compounded hormone therapy that is being covered under this plan.
All right. Another email from Alexandra. She says, "Hi there. I'm a 45-year-old woman and wondering, under the old plan, my patch has been covered, which I'm thankful for. However, due to an allergic reaction to the patch, I've been using an inhaler to my skin to prevent a reaction. I was wondering if I can get the Pfizer brand instead under the new plan. It's a lot smaller and I don't have a reaction to using that." Dr. Green, do you know about that? Oh, Dr. Fisher, sorry.
I am not sure that they're covering the non-generic estrogen patches, but that said, there are a number of different estrogen patches that they are covering. They're covering estradiol, they're covering a Climera patch. So it depends on which patch you were using before, but there might be an alternative patch that is covered. Or there's also transdermal gel and cream that are being covered as well, and they're equivalent to the patch.
All right. We did get a call from Lynn, who's a pharmacist on Salt Spring Island, and she said estrogene is also not covered, and Vagifem, I believe, is not covered in the new pharmacare. Is that true?
They're essentially covering the lowest cost alternatives of both of those products. So Premarin cream, it would be roughly equivalent to Estrogyne. And Vagifem is estradiol. It's a 10 microgram dose, and that's being approved as Imvexi, which is just the same medication, but a slightly different formulation.
Okay. Leslie writes, "It is very important to include a very overlooked complication of HRT for women who have a family history of breast cancer. While the benefits of HRT are great, it directly triggers and contributes to hormone-positive breast cancer. That was the case for me. The bulk of doctors and nurse practitioners are unaware of this, and I would urge the correlations to be part of the education and information so women can be empowered in their choices." I'll talk to both of you about that, but I'll start with you, Dr. Fisher.
Yeah, I think that's one of those very specific situations where are health concerns that might not make you fit into the cookie cutter approach to normal menopausal hormone therapy.
Right.
I would say, though, that I treat a lot of patients who have hereditary breast cancer in their family, although they don't themselves have breast cancer. And really the overwhelming risk factor in that scenario is their family history. And then any contribution of hormone therapy to that risk is actually really quite trivial.
Okay.
So then it becomes a really personal choice for that woman, what benefits she perceives in terms of her overall quality of life. So it's not a contraindication.
Okay. And Callie, we see this, though. There is often misinformation. There can be a lot of tricky things to navigate when you're in this inevitable stage of life. What would you want to say to women who feel, sort of underserved, but maybe themselves feel undereducated about this stage that they've reached in their life?
Yeah, I think the key thing is really to make sure you're getting your information from a trusted source. There is so much misinformation out there, especially around menopause. And I think, whether it's going to our Women's Health Research Institute website, whether it's talking with your family doc, whether it's making sure you're just getting the right information. And and like Dr. Fisher said, not everything is cookie cutters. So you need to really make sure you talk to your physician.
All right.
Yeah.
It has been so wonderful to have both of you in here and able to answer calls. I'm sure we only barely touched half of the things that women are wondering about, but I think every little bit helps. So thank you. That was Dr. Stephanie Fisher, the Interim Senior Medical Director of Gynecology and Specialized Programs at BC Women's Hospital and Health Centre, and Callie Wesson, the President and CEO of the BC Women's Health Foundation. They joined us in studio. And you can join us next Monday for the second segment in our Menopause Monday series this month. That's it for our show for today. Thanks for joining us.